Welcome, Bulldogs, to our Ask the Expert series, where we're engaging you in topics that are relevant to you, such as networking, resume prep, and other things that young alums are doing in their field of study. Today, we have JoJo Dodd, who's a third-year medical student at UMMC in Jackson, and he also serves as the chairman of the Jackson Free Clinic, which is a student-run free clinic in Jackson, Mississippi, that offers free medical, dental, and pharmacy services to anyone who lacks health insurance. JoJo is also a 2016 graduate of Mississippi State University. While he was a student here, he served as student body president, the writer for The Reflector, and he was even on the mascot team. We also have Brittany Corder and Melanie Brunfield Baker, who will serve as moderators. So I'll turn it over to you, JoJo. Welcome.
Yeah, thanks, Brady. Thanks for having me on here to talk to other alumni about what we're doing with our degrees at Mississippi State and how we're leveraging that today. And so principally, kind of why I'm here is talk about the Jackson Free Clinic and what we're doing there. And actually, I am one of many Mississippi State alumni who are medical students, pharmacy students, dental students at UMC who are a part of the leadership team of the Free Clinic. And the work that we do is important work, serving those who lack health insurance, expanding access to healthcare to those who need it, but also the Free Clinic, part of our mission is to train pre-health and pre-professional students at the clinic with patients and give them a chance to get hands-on experience there. And so we're helping those most vulnerable, but also we're doing our part to train the next generation of healthcare providers for our state. So it's a fun thing to be involved in, and I'm excited to talk about it.
Awesome. JoJo, we're so glad that you're here today. I know that you have had a wealth of experience at Mississippi State, being student body president and all that good stuff. And then now have just turned all that Bulldog energy into something awesome for the community in our state and in Jackson. To start off, can you tell us a little bit about how your experiences at MSU have shaped you and gotten to you to where you are right now? How has it impacted your post-grad life to be a Bulldog?
Yeah, so I mean, first of all, Mississippi State got me to medical school. Obviously this is kind of geared toward alumni, so I won't do my recruiting pitch for Mississippi State, but I could easily jump right into it. Mississippi State got me to medical school. And so I came in Mississippi State, not quite sure what I wanted to do. I thought marketing maybe. I ended up getting an economics degree, but took the classes on the side. And so it's through like the pre-health kind of advising center, they kind of shepherded me to medical school. And then once I actually got in medical school, the lessons I learned from the student association, but also maybe ironically the mascot team, how to work together to kind of pull off something bigger than yourself, has been tremendously helpful in the Free Clinic. The studying piece and kind of the academic part, you got to do on your own. But the parts of medical school that have opened up to allow me to be a part of a team that is accomplishing these kind of big visionary tasks. The Student Association in particular has been helpful to do. The Jackson Free Clinic structure, as an example, we're actually an independent nonprofit organization separate from UMC technically for legal and some practical reasons. And the structure of that organization was frankly kind of in disarray. I mean, a bunch of students doing a bunch of good work, but not super organized. And so to kind of any outside person looking in from Mississippi State, the Jackson Free Clinic's current arrangement looks a lot like what Cabinet looks like at Mississippi State and the Student Association. So we've brought some of those lessons from state down here to Jackson, and now it's helping gain people access to healthcare.
Awesome. JoJo, following up on that, you mentioned the Jackson Free Clinic. We've talked about it a little bit, but I think it'd be interesting to kind of share more information about kind of the amount of patients that we reach, kind of the services that we offer, and kind of how students and young alum could kind of interact in the JFC.
Yeah, so first of all, the JFC is called the Jackson Free Clinic, but our patients come from all over the state. And so 60% of our patients come from Jackson. The other 40% come from pretty close to Jackson, most of them, but a lot of them come from pretty far away: Columbus, Starkville region, Golden Triangle in general, Tupelo, Oxford. I mean, literally they come from all over to come get free healthcare. It's kind of amazing. Our perception of what uninsured looks like is sometimes someone who may be homeless or someone who doesn't work. And we do certainly serve those populations at the free clinic, but the majority of our patients are working people who are just not able to afford health insurance or in some way fall through a crack to be covered. And so you've got folks working really hard and still unable to afford it who use our services at the free clinic. So it's kind of an eye opener when you're at the free clinic and you see people who are managing 2 jobs, but still have to come and get their diabetes managed by a free clinic. So that's who we serve. Last year, we did about 1,400 patient visits, nearly 700 individual patients. COVID's been quite the disruption for us on the student volunteer side and also the patient side. And so navigating that has been a challenge and one that we feel like we've kind of risen to. And so we started doing telehealth visits as well. And so we saw about 370 telehealth visits for the first time starting in June of last year. That's just in 2020. And so the free clinic is dynamic and always changing. And again, we're led by, I think, the largest university graduates that are involved in leadership is Mississippi State. And that has in large part to do with the fact that most UMC medical students and dental students, as again, the largest contributing university is Mississippi State. So there's some good blood down here in Jackson helping to lead this organization. And so how folks can get involved, if they're at UMC and they're UMC students, they can be involved on our Saturday clinic days. We're open once a week on Saturdays. And so again, lots of students are involved as volunteers on Saturdays. And if you're not in the medical field, dental, pharmacy, et cetera, here as a student at UMC, you could go to our website and find more ways to get engaged, certainly in the supporting of the free clinic. And so our overall annual budget is pretty small relative to the work that we do. And so any contribution toward the free clinic goes a long way.
Awesome. One thing I wanted to kind of touch on, you mentioned COVID pandemic just being revolutionary, I guess, in the way that the Jackson Free Clinic was ran and ways that you rose to the challenge. But I think it'd be interesting to maybe touch on kind of some of the efforts we've made on the vaccination front and the patients that we've reached in that regard, as well as kind of like maybe goals that have been set, maybe official goals, non-official goals, maybe personal goals that you have regarding COVID with the clinic.
Yeah, so one thing that was important to us in the beginning of COVID was continuing to serve our patients through the disruption while making it safe for volunteers and for volunteers and for patients. And so we put a lot of work into kind of putting these processes together and kind of in the beginning, putting these things together in kind of a sense of uncertainty still, not really knowing what exactly was going to happen, screening patients for symptoms, that kind of thing. You know, we're trying to manage their diabetes and hypertension while trying to avoid exposing them to COVID and our volunteers as well. So that was a challenge. And then in the back half of the pandemic, or the back part that we're in kind of now, the focus shifted to vaccinations. And so it was, how do you get the patients that we touch and that we have access to, how do you get them vaccinated? And so, you know, you had all these big kind of statewide National Guard run, Department of Health run sites, but they were not accessing all of the patients that we see. And so in the very beginning kind of the vaccination effort, you saw a disproportionate amount of African Americans going unvaccinated. And so the vaccination distribution for our state, they were disproportionately going to kind of white Mississippians and non-African American Mississippians, despite the fact that you have 38% African Americans in the state. And there was 2 pieces to that, kind of the explanation. Number one, the first explanation was vaccine hesitancy and healthcare distrust. And so one thing we have with our patients is that we've earned a trust with them over time. And so we felt like we could be a vehicle to deliver vaccines to our patients because we've already overcome, at least in an important amount to get them to come to our clinic. We overcome that hesitancy with healthcare and those patients. But I think the vaccine hesitancy and the healthcare distrust was certainly one piece of it, but I think it was also sometimes overstated. The biggest piece was access. And so you've got people who just don't have access to healthcare. And so the vaccine big distribution sites just were not reaching them. And so you've seen the Department of Health, along with us and other small clinics like ours, we've been asking for some time to give us direct vaccine access so we can get those vaccines to our patients. And you've seen an uptick in kind of the distribution equity of the vaccine. Mississippi is in the top 10 in the country right now for vaccinating African Americans at parity with the population. And if you take out like the 5 states who have like 1 and 2% African Americans in the population, we're way higher up that top 10. And so Mississippi right now, we think we're at 34% of vaccines distributed for African Americans, and again, 38% are on our population. And African Americans disproportionately have been affected by COVID. And so the majority of deaths have been African American in Mississippi. Majority of cases of African Americans, about 55%, and 41% of deaths have been African Americans from COVID. In our clinic, Jackson Free Clinic, we have about 78% African Americans in our patient population. And so we thought we were a good vessel to be able to help deliver vaccines to our patients who lack access to healthcare, but still want the vaccine. And so lots of students, Melanie included, have been involved in helping to kind of orchestrate and implement our vaccination plan. And so we're still vaccinating patients at our clinic. We're also working on vaccinating some other kind of classically disenfranchised populations, which would be the immigrant population in Mississippi. So Jackson's got a relatively small Hispanic population, about 4.5%, but the areas surrounding Jackson have a large Hispanic population with migrant workers and things of that nature. And so we're actually taking vaccines from our clinic up north of Jackson to have these vaccination events targeted at the Hispanic population that wants the vaccines, but again, has some distrust of healthcare issues and some access issues that we're working to fix. And it's complicated, of course, by the fact that some vaccines require 2 doses at certain intervals. And so once you break through that access problem the first time, you're now confronted with a second time having to break through that access problem to get their full dose. And so we had a solution at first, which was the Johnson & Johnson vaccine, which of course, if you're following the news at all, had some hiccups, to say the least. And so was paused due to some side effects and some clotting concerns. It's back and available again now, but you still have some issues with distribution of that vaccine. So it's complicated, but you've got lots of students here who are running the free clinic who are working really hard on it.
That's absolutely incredible. I love to hear the innovation. It's clear that the folks at JFC see a need and are filling needs where they need to be filled. Shifting gears away from COVID, you've had a lot of really exciting developments on the dental side of the Jackson Free Clinic. Can you tell us a little bit about those services?
I can, yeah. So our dental services, you probably have some of the coolest patient stories that are on the dental side, because these people have just this tremendously debilitating oral pain and they have nowhere to go. So they call the free clinic. And so all we do is extractions. We'll take teeth out. And so teeth that are hurting someone, infected, et cetera, we pull teeth. And so we are slammed every dental day that we're open. People coming from all over. Literally 2 weeks ago, someone called for an appointment. We scheduled them and they said, okay, if I leave at 3 a.m., I can be there by 10. They were in Texas and they were just trying to find somebody to pull this tooth for them. And they had several teeth need to be pulled. They drove 7 hours to get this dental service done. And so it's obviously meeting a tremendous need. And so in the past, we've only had 2 dental rooms. And so in the beginning of January 2020, kind of pre-COVID, we were booked until May as far as our appointments. And so if you call in January with this, again, debilitating oral pain, and we tell you, okay, we can see you in 4 or 5 months, it really isn't a solution. And so we got to work trying to fix that. And so we ended up remodeling and redoing a building beside our main clinic to be the standalone dental space. And so we went from 2 rooms to 6 rooms. We actually got that job done thanks to, in part, a grant from the Bauer Foundation, but also thanks to the generosity of a state alumni, Dr. George May, who is an oral surgeon here in Jackson. He played football for Mississippi State, actually. But he was a tremendous kind of help, both emotionally and financially, to get that job done. And so now it's open, this new space, so which allowed us to, first of all, backfill the old dental rooms with new medical rooms to serve more patients on the medical side. And then also on the dental side, we're seeing tremendous volumes, and we're trying, and we are expanding our services to be more than just extractions, but also do some preventive dental work, get dental hygiene students involved. And so rapidly escalating what we're able to offer patients, both in volume and in the scope of our services.
That is Awesome. Okay, so I want to know about what's next for you. I know you're heading in to M4 year very soon. So how has your volunteering and work with Jackson Free Clinic shaped what you think about the healthcare field and kind of impacted on what you want to be when you grow up?
That's a great question. So, I used to joke that, I still joke, that you can't come to the Jackson Free Clinic without knowing that there's a problem, right? Like you see these people who, again, many of them working really hard, have families, they're your neighbors who just are uninsured. And so you can't leave JFC as a volunteer without knowing there's a problem with our healthcare system. But you also don't leave JFC any better equipped to understand it or fix it. I don't pretend to have the answers to our healthcare problems, but I do know I want to be a part of the solution. And so, our generation of graduates are rapidly approaching the age and kind of the place in our careers where we'll begin to be those policymakers and be those advocates for whatever thing that we're interested in. For me, it's healthcare. And so I'm looking to kind of get involved in that. I'm in the Navy, and so the Navy is paying my way through med school, and the Navy expects me to go pay it back afterwards. And so I'll be a Navy doctor after a residency. And so for me, probably emergency medicine. So I'll work in the ER, and then I'll serve in the Navy for a while as a Navy doctor after residency. So then after that, there aren't many places in Mississippi I can go as a Navy doctor. There's a couple, but not many. And so I'll likely be gone from the state during that time, but I'll be back. And so hopefully to be back and help be part of the solution, help be part of the folks doing the work to find solutions for healthcare in our state.
Awesome. Brittany, do you have any questions?
I had one question, JoJo, and we kind of maybe backtracking just a little bit. I think it'd be interesting for you to talk about also like the pharmacy side of the Jackson Free Clinic, because these patients come in, need long-term care or need some kind of supplemental medication. And I know the JFC offers some, so I just thought you might want to touch on that.
Yeah, patients like ours who come to the clinic because they're uninsured get a bad rap a lot of time because, and sometimes from jaded people who've been in healthcare a long time, they see a patient who's uninsured coming to a free clinic and they think I can prescribe and give them whatever I want as far as the healthcare plan goes, but then they're not going to do it. They're going to be non-compliant, or they're not going to follow up. All these things that you just kind of assume someone who's dealing with poverty or healthcare access, even if they get to the clinic, you're like, whatever I do doesn't matter because they won't follow through on it. But if you back up a bit, kind of the reason for that is because the very reason they lack access to healthcare, they have uncertain transportation often. They often can't afford the medications that are prescribed to them. And so one thing that the free clinic does is intentionally try, when we're prescribing to an outside pharmacy, to prescribe the cheapest thing and actually run it by our patients. Hey, if we prescribe a pill for you that costs you $10 a month, can you afford that? And sometimes the answer is no. And so if you prescribe someone a medication or a plan that they can't afford from the beginning, it's just not going to get done. It isn't the patient's fault. It's actually our fault as a providers for not taking kind of into account their situations. And so sometimes at the free clinic, you'll do things and provide therapies that maybe aren't the best therapies, but they're what they can afford and what they'll actually follow through with. And so as a part of that kind of problem and addressing it, we've been working with our pharmacy team, our pharmacy students who are involved, and our pharmacy faculty to begin offering more medications to our patients at the clinic itself for free. And so through some partnerships with some pharmaceutical surplus distribution networks, we've been able to kind of have a dispensary at the free clinic that we can prescribe basically patient medications from ourselves. And so those meds are always free to the patients, but it isn't really enough as far as the amount of medications that we have there. And so oftentimes it'll be 2 or 3 medications from the outside pharmacy and maybe 1 or 2 medications from our pharmacy. We can kind of balance those things. And so we're saving folks money all the time, but we're trying to do more and trying to kind of increase the dispensary list that we have access to. And that's just the medication kind of piece of it. It's just one part of the entire patient, kind of the whole patient you're trying to treat. And so patients come to our free clinic with medical problems, but also have lots of other social issues going on that we can't fix, but do impact their healthcare. And so it really is a complicated, interwoven kind of social determinants of health, if you will, that we're dealing with. And we're trying to do our part and influence parts that we can, but we can't kind of do it all.
Right. Awesome. I think that was my last question. Mel, you have anything?
The only other question I have is the one that we talked about before we even started about, you know, medical school, professional school, no matter where you are, it's really difficult to stay involved with the Alumni Association, but I think you've done a great job, JoJo. Correct me if I'm wrong, but didn't you serve on the Young Alum Council?
I did.
You did. Awesome. So tell us a little bit about what, you know, what it's like to move to a new city, jump in and get involved with the Alumni Association, and, you know, what the time commitment looks like, and if it's, you know, if it's doable as you start like this great new transition of post-grad life.
Yeah, you know, when you're at Mississippi State, beginning an orientation with Dr. Keenum and your orientation leader, you're just preached to that getting involved is the way to find success in Mississippi State. And if you're watching this, you probably were involved in Mississippi State while you were there. You probably follow that advice, and it's good advice. You find friends, you find a connection, the community, a network, and it is just, there's no reason to leave it behind when you graduate. You'll have your friends, you have those friendships you made that certainly you know stay in touch with, but the larger network of Mississippi State, it's a shame really if you just kind of leave it behind when you finish it in Starkville or Meridian. So I think for me it was wanting to continue to engage Mississippi State, and I know from experience that when you engage Mississippi State, typically you get more out of it than you put in. And so for me, the alumni recruiting network was really fun. In a way that I found kind of fit my time that I had available, but also let me stay involved in the recruiting part for Mississippi State. So I was able to write letters to specifically medical, pre-health professions students, and at their phone numbers, I would call them. And so for me, it kind of helped me remember where I was, you know, 5 years before, 6 years before. And as you advance in your career, I think it's always important to take time to stop, turn around and offer a hand back. Because I'm always looking for a hand up, you know, looking for a way to advance and some connection to help me get to the next place. We should remember that we're also kind of part of that ladder, helping folks behind us advance. And so for me, that was the Alumni Recruiting Network. I have enjoyed staying involved in kind of the larger alumni association with the Central Mississippi chapter down here. But the most fun I really had has been in helping recruit younger high school students to come to Mississippi State. I haven't had a lot of fun with that, and hopefully some success, but I don't know. I've enjoyed writing the letters at least.
Well, I have to just say, for the three of you, I think we all owe you a big thank you. What you're doing, especially after this year with the COVID-19 pandemic and everything that the three of you are doing. It's kind of neat to hear about what's going on the front lines, especially at Jackson Free Clinic. I don't know if a lot of people are really truly aware of what you all do, JoJo, down there. It's really impactful work. I think that obviously the state needs, but it's great to see other Bulldogs coming together to get the work done. So I really appreciate all three of you joining me today and for this series of Ask the Experts. If we don't have any other questions, we'll see you all next time. Hail State.
Awesome. See ya.
Hail State.